topic hypersexuality. On seeing this topic, definitely I wondered whether this is going to be a disease. And on seeing the presenter, definitely I appreciate. So for this topic, we do have an attractive speaker, Dr. Kiran Kumar. So he has done his UG in Jipmer, PG in Chandigarh, and he is now presently as working as a consultant endocrinologist in Salem and Kalakuchi, and he has a lot of publications. And before going to the presentation, one important doubt, sir. Why this topic is being, what is secrets behind this topic on assigning this topic to you, sir?
Okay, you should ask Dr. Kumaravil. And at the outset, I thank Dr. Kumaravil. He called me a month back. He gave me two topics. One is hypersexuality, other is on love. I told him I'm not the right person to talk on love. I rather take this topic which I'm familiar with. And Dr. Kumaravil, maybe at the end of the talk, he might enlighten. And hypersexuality, to some extent, is an endocrine issue. We treat such patients, we give generic analogs and to do chemical castration and medical castration in them. So it also covers the specialty of endocrinology.
I also searched the books, sir. Exactly, we do not know.
Yeah, we'll cover that definitely. And so this is going to be an exciting topic. And again, thank Dr. Kumaravil. All is full. So for the next 20 minutes, we'll look into the evolution of sexuality in humans, and we'll look into hypersexuality in particular. So here we go. So sex is the basis of life. I think everybody here will accept this. The clay craving, what you see here, dates back to 2000 BC. This is presently in London Museum. It dates back to 2000 BCE. It belongs to the Babylonian civilization. The encryption there says that sex is the fundamental for survival of each and every species in this world. I think all of you will agree with me. If you look at the evolution of sex, it has went through three phases. The first phase is the stage of aphrodisiacism. Basically, in the beginning of the human history, there were a lot of chaos and there were a lot of promiscuity. That was called as the stage of aphrodisiacism. And second is the stage of domesticism. Otherwise, easily we can say that this is referred to as a matriarchal period, where women was the center of all family and they had a higher role to play, and all the descendants were begins with the mother, and they had a higher role to play both in the social life and also in the sexuality. The third stage is called as the Apolline stage, or the present patriarchal stage, where a monogamous relationship is followed and is considered universal, and all the descendants are traced back to from the paternity, from the father, and male have a higher role to play in the sexual life. So what we'll do in the next 20 minutes is we'll look at the history of human sexuality, then we'll look at the present sexual practices in our country, and also define hypersexuality, the various causes, the differential diagnosis and treatment. When we say ancient India, it includes not only the present India, but also it extends to Pakistan, Afghanistan, and also to Java, Sumatra, and Cambodia, and Thailand, Laos, and the other countries. So we were very much advanced initially with respect to science. The contribution of India to sexuality is huge. There are a lot of sexual education that happened during this period by way of art and also literature. And these literature were also imbibed into the Persian culture and also in the Chinese and other various culture. The documents are still not existing, some of them do not, but we have a lot of references to the literature which was done in this field thousands of years back. And our people those days had a higher understanding of the sexuality, and though they were highly advanced, there were two types of very few people received education, the other people don't. So in the king, the nobles and their warriors and those who were educated had a different way of sexuality and practice, whereas a common man who is uneducated had a different understanding of that. And you see lot of architecture like this from Tamil Nadu to Karnataka to Andhra to even Jammu and to Gujarat. So basically, the sexual education was imparted as art during this period, and wherever you go, whichever temple you go, in the common area you see sculptures like this. What you see here is the Apsaras or the Devadasis who were present in the temple throughout their life, and they were seen as a direct people who become this one to mediator between the king and the gods. And these were almost synonymous to the nymphs which we see in the Greek history, in the Greek mythology. And the right hand side, what you figure, what you see is the good depiction of the romantic relationship that happens between a male and a female. And you also see the other things which you don't want to see, the masturbation done by a male and a female there. So these type of sexual expressions were common and they were socially accepted during those times and they were in the midst of everywhere to see. Then from the art it went to the literature. If you look at the literature which was well written was the Kama Sutra. It shows 64 ways of making love, and this is one of the photos taken from the textbook of Kama Sutra. It was initially translated in English and to the various other languages, and it looks at sex as a science and art, and has to be done in a approach should be a scientific way, a time-tested one. And similarly, not only in the Hindu religion but also in the Buddhism, you see sex being discussed and being manifest and being widely exposed. This is the painting taken from the Ajanta Ellora caves, where you see women having relationship with women and also simultaneously with the men. So these are the various things, men with men, women and women, were existent even from those days. Though it was considered illegal till 2 years back. And this is the photograph taken from the Japanese civilization, dates back 1000 years back. And these are the various coins from the Roman period. If you ask one civilization where hypersexuality was to the peak, it was the Roman civilization. In fact, if you happen to see one of the movies of Tinto Brass, the Caligula, you would have seen this. The whole Roman Empire had fallen because of the hypersexuality of the king called Caligula. And these are the various erotic figures which they had in their coin. And that means to say that they had acceptance to everything. And also this painting from Pompeii in Rome, where you see have men with men and women with women. So these are all there even 3,000, 4,000 years back and was well accepted. And similarly in India, if you see male and female, there was also the third sex called a hijras, which was banned and they were being prosecuted in the periods of colonialism. So our understanding was different. However, after the invasion of the Mughals, after the colonial this entry of the Britishers to our country, the history was rewritten. Britishers were of a conservative society and they believed in monogamous relationship, and what they actually did was they banned the hijras, they banned the devadasis, and it brought a lot of changes in the Indian Penal Code. The Indian Penal Code was written in 1800 and prostitution was banned and so many other things happened, and monogamy was given the importance. And one such thing is the Article 377. It was enacted in 1800, which bans prostitution and also the homosexuality. As post-independence, the same trend continued. There was the censorship, and even the kissing scenes should not be seen. So, and the production of various films related to the sexual content were banned. Even the transmission in the electronic media was banned. And of recently, these things have happened. Even in the electronic media, in the internet, the ban has happened. So we see a drastic change in the evolution, the concept, and the way we look at the thing which is so much important and vital to our existence. So much ban there. And even if you look at the prostitution, which was the oldest occupation in our country, was banned. That ban happened in 1800, and this led to a lot of STDs and the promiscuities and unsafe practices. And finally, 2 years back, the Supreme Court has banned when we taken out the prostitution from an illegal thing, and now it has been made legal. And now the Supreme Court says prostitution has to be viewed as a profession, but also says that it should be safely done. So sex has evolved over centuries, and so many ups and downs have happened, and this has become a great relief for the LGBT group. So from the glorious past, what is the present practices of sex in our country? Let's see. From an advanced being, we have brought down to a country where the sexual dysfunction are more common nowadays. 1 out of every man has got a sexual dysfunction in the form of erectile dysfunction or premature ejaculation. 1 in 7 females have got this hyperactive sexual disorder, and this sexual dysfunction is more common in illiterates. Now also this also has led to this poor sex education in our community has led to a lot of teenage pregnancies and illegal abortion and also increased mortality and morbidity due to that. And the poor people even now come with a dark sin. We make fun of them, but because of the education is poor, still it is very, very prevalent in our community. So these are the various evolution that has happened. And this is the recent data which had come. People had a questionnaire to all the people. How frequently you think about having sex? 95% of the people told that they think about having the intercourse daily. But then the next question is, how frequently do you have? 65% had it only 3 times in a month, means once in 10 days. So the present practices are not good and education needs to be given. That's the interpretation from this data. However, though we say sexual dysfunction more common, there are certain category of people who wanted it more, and this is the group of people we are going to talk, see in the next 5 to 7 minutes. We see lot of oppression against women, lot of crime against children. Who does it? Maybe this group of people with hypersexuality are prone for doing this, and recent uproar for the justice is still continuing, and we don't know how long it will go. Is again maybe because of a person with this trait, and we'll see in detail the subsequent stage. So it's no more a myth, it's reality. When we say hypersexuality, it is otherwise called as various names like compulsive sex disorder or sex addiction. Basically, there is a persistent pattern of excessive fantasies or urges or sexual behavior which causes a significant distress to the patient's day-to-day life, his relationship with others, and also to the overall well-being. So persistent pattern of recurrent intrusive thoughts and behaviors which disturbs the everyday life of the patient and also reduces his productivity and his relationship with others is the thing. There is another group which look into as a different one, the total sexual output. They say if there are more than 7 orgasms per week, then they say it will qualify for a hypersexual. However, this pattern should persist for around 6 months to clinically diagnose them as having a hypersexuality disorder. What is the prevalence? Surprising 3 to 6% of the population have this disorder. In various ethnic populations, this and various cultures, this can go up to 10%. Males have more hypersexuality disorder than females. So there are 3 characteristics of a person who has got a hypersexuality. One is sexual compulsivity. They have a repetitive behavior or mental act, and when this happens, they become more distressed and anxious. And if they don't do that activity, which could be a sexual intercourse or a masturbation or watching a pornography, their distress increases. So they have to do it to overcome the distress or anxiety which happens. And once they do it, it subsides. And the same cycle continues. People have seen the roots dating back to the sexual trauma or childhood abuse which happened in the early part of the life period. The second characteristic other than compulsivity is sexual impulsivity. So basically they have an inability to resist an urge or a temptation. See, we all have temptation, we all have urge, but we are able to resist it. We look at the environment, we look at everything, and we behave in such a way that it doesn't harm us or others. Whereas they act with little thought, and they do things without even after knowing the consequences, and they end up harming themselves and others. And they have a cycle of dependency which happens again and again because of this impulsivity. So compulsion and impulsivity are the cornerstones of a person with hypersexuality disorder. You might ask me why this happens. See, everything lies in the frontal cortex. We know that inhibition center is present in the frontal lobe. These people have excessive dopaminergic innervation of the frontal and prefrontal cortex. And we know the reward center is there in the hippocampus. We call this nucleus as nucleus accumbens. So there is a crosstalk between nucleus accumbens in the hippocampus to the prefrontal and frontal cortex. There is excessive dopamine innervation of that area, and this is the reason why these people doesn't have any inhibition. They act even after knowing the consequences. And this is the center for arousal, this is nucleus accumbens. And in patients with hypersexuality, they have frequent arousals that happens. You look at the percentage what you see here. So even in a single day, they have multiple arousals and they succumb into it. What happens when we have arousal? We have two inhibition. One is the threat of performance failure. What happens if you don't do it properly? That prevents us from proceeding. The second inhibition what everybody has is threat of performance consequence. If I do this, what will happen? What will other things happen? Other things. But these people will not have this inhibition. As a result of that, they end up getting a dependence cycle which happens again and again. And yearly exposure to cyber sex and chronic exposure at a younger age is seen as an important risk factor for hypersexuality. So parents, be careful about regarding your children and their access to such content. What happens whenever they do this, there is a euphoria that happens in the brain because many neurohormones which makes you feel good are secreted when they do that act. It could be masturbation or it could be a pornography or anything, and they develop a psychological dependence to that. The cycle continues again and again, they develop a dependency to that. So, coming to the neurobiology of hypersexuality, it is not psychological, you have to believe it is pathological, and they have a emotional disengagement at the level of the frontal cortex. Childhood abuse and neglect, parental neglect at the early age could be a triggers for this, and even some intracranial lesion can present with hypersexuality, so one should remember that. So having said that, does the word hypersexuality is a disease recognized by DSM-5? The answer is no. It is seen as a part of paraphilias. So till now it has not been given a diagnosis status. That's what Sir asked me. So the literature is less because it has not been considered as a disease. So what does DSM-5 says in paraphilias? If there is excessive time spent on sexual fantasies or an arrangement to have attained that state, or if there is repetitive urges and act done to overcome the dysphoric mood, or if there is a repetitive urges or sexual act to overcome stress, or if there is repetitive failure to overcome the temptation, or if there is repetitive act which led to harm of himself and the others, then it should be looked as an hypersexuality disorder. So 3 out of 5 will qualify a hypersexuality state. And they should be above 18 years of age, and basically they have a lot of personal distress because of that. They have a problem with their occupation and also interpersonal relationship. And substance use should be ruled out, otherwise it don't qualify for a hypersexual disorder. So what are the addictions which these people can have? They can have repeated masturbation, repeated pornography watching, and most time spent on that, or indulging in sexual behavior with a consenting adult, or it may be even a cyber sex, or a telephone sex, or even visiting frequently the strip clubs. And there are many screening tools available. However, having said that, there are many psychiatric disorders which are present with hypersexuality that should be ruled out. So what are the differential diagnoses? Any traumatic brain injury involving the frontal lobe or the parietal cortex can present with hypersexuality. So take a proper history or any lesions there. People with Parkinsonism, especially the Parkinson-Presque syndrome, has the involvement of the frontal lobe. They have loss of inhibition, can present with hypersexuality. Dopamine agonism, which is used as a treatment in these people, can aggravate the hypersexuality in them. So that should be done. Then people with dementia, because they have loss of inhibition, they will indulge in the hypersexual behavior. So this is another medical psychiatric condition or medical condition which presents with hypersexuality, and this should be ruled out. And substance abuse, the cocaine, the marijuana, all will stimulate your hippocampal area and make them to go on to a spree and to indulge in various activities which harms others and themselves. Then this we commonly see as an endocrinologist. Anybody who comes with a prolactinoma, male or a female, the moment you start on cabergoline, which is a dopamine agonist, they come back within few weeks later telling the hypersexuality because they had complete loss of libido before treatment, and once you treat them, they come with an increased libido, and many people want the drug to be stopped because being a dopamine agonist, we actually give it for people with poor libido. This is one of the areas which we should think about when such behavior happens. Whether the patient is on any drug that does this. Then psychiatric disorder, bipolar affective disorder, schizophrenia, psychosis, all have hypersexuality as one of the manifestation with other qualities of those diagnoses. Especially in the maniac phase in BPAD, they present with hypersexuality. And many personality traits and disorders like bipolar, borderline disorder, antisocial behavior, histrionic and narcissistic personality disorders, they can present with hypersexuality. And a recent event which happened in Calcutta, the person was never regretting, he was not having any guilt for what he had done. Where that person could as well be one of the person having this type of personality disorder, which motivates them to indulge in that without even looking at the consequences, what happens after that. So treatment is mainly the psychiatrist's role. They do cognitive behavioral therapy, and they also do psychodynamic psychotherapy. Just 2 minutes. Psychodynamic psychotherapy, multiple setting, it helps. There are many studies which have seen that shown that citalopram is useful, and people have seen fluoxetine being useful. And the best drug which is very promising is naltrexone. It being an inhibitor of both endogenous and exogenous opioids, it blocks dopamine receptors and has been successfully used to block the reinforcement and also the urge what they have. And mood stabilizers like lithium alpirate is useful. Aripiprazole being antipsychotic actually worsens that. The person has that, think of this drug, and benperidone is a drug which has been used for sexual offenders in US. And as an endocrinologist, we use GnRH analogs for chemical castration, reduces GnRH pulse frequency, reduces LHFSH, and reduces testosterone. So to conclude, sexuality evolved over many centuries. There is a lot of ethnic and cultural determinants for it. Hypersexuality is a hidden entity. We don't come out to the doctors that easily. Special care needs to be taken for them to prevent many crime against what we see nowadays. So timely referral to a team where it is managed properly, and also adequate use of psychotherapy and pharmacotherapy helps them to give a better quality of life to these people. Thank you.
Thank you so much. Now I could understand why UK has given this topic to and because of lack of time, any questions can be asked personally to Dr.
Thank you, Dr. Kumar. That was a very taboo topic. And the reason we wanted to give the taboo topic was we as doctors should come out of that word taboo. We should be not getting the word. We should not feel we should not hesitate to discuss or get this topic. We should be open enough to receive this topic from our patients and help them. That's the reason why. And definitely Dr. Kumar did an excellent job. Thank you so much. I appreciate that. Awesome. I invite Dr. Pandikumaran sir to felicitate our speaker. I invite Dr. Shriram Mahadevan to felicitate our chairperson.